Hi everyone, I'm Ardith Biakan. I'm presenting Integrating Methods of Quality Improvement. For my presentation, I'm using a near miss incident in which a patient at my hospital became hypoglycemic. And this case is something that can happen at any other healthcare facility. In this case, TK, a 69-year-old female, was brought to the ER by a family member and was admitted to the telemetry unit under observation for uncontrolled hypertension. TK has a history of hypertension, hyperlipidemia, and borderline diabetes. She has orders to have her blood sugar checked before meals and at bedtime, which is to be covered by insulin, which, by the way, TK has never taken any medication for diabetes. Before a change of shift at around 6:30 a.m., Nurse Jackie checks TK's blood sugar, which was 316 milligrams per deciliter. Normally, the next shift will cover the insulin scheduled at 7:30 a.m., which is about 15 minutes before breakfast trays arrive. Nurse Jackie is a new nurse who has been on her own in the last week following a training with a preceptor for just 2 weeks. Nurse Jackie decides to administer insulin coverage right away, and because she is within that hour window that is scheduled, she thought it was okay. She had another nurse co-sign the insulin who verified the coverage needed but was too busy passing her medications to question the early administration of insulin or to remind Nurse Jackie that it should be given when breakfast trays arrive. At change of shift, Nurse Jackie and incoming Nurse Tom comes to TK's bedside at 7:15 and notice that TK is complaining of dizziness and lightheadedness and is somewhat confused as to where she is at. Nurse Jackie reported that TK did not have any complaints throughout her shift and is now presenting with acute complaints. Nurse Jackie reported that TK's morning insulin was given as it was within that hour window to be able to administer medications, and stated that TK's breakfast tray would arrive at 7:30 a.m. anyway. This alerted Nurse Tom, who immediately checked TK's blood sugar, which was now at 66. TK was then given orange juice, a graham cracker, and glucagon. Nurse Jackie seemed worried and then remembered that Humalog is a fast-acting insulin. Nurse Tom rechecked TK's blood sugar thereafter, which was now normal at 91, and noted that TK was alert and fully oriented and no longer complained of dizziness or lightheadedness. By that time, TK's breakfast tray finally arrived at approximately 8 a.m.